Kidney blood test explained. Creatinine, BUN, eGFR. Doctor breaks it down. You get your blood test done. You get a bunch of papers with various reports in it. You go to the KFT, Kidney Function Test, and you see some values, some odd values, some good values. You go to the report and see that your urea is high, your BUN is high, your creatinine is high, your eGFR is low, your UACR is high. All these are problems. They are in bold or in red, they are in italics or underlined. So what to do? Don't worry. I will tell you the simple tricks to understand the reports. And there are some reports which are of course important, and there are reports which may not be that important. So let us go into the nitty-gritty. Chapter 1. Why kidney blood tests matter? First and foremost, our kidneys are the cleaners of our body. They remove the waste products, remove the poisons, maintain the fluid balance, and also help to maintain the blood pressure of the body. But then kidney disease is most of the time silent, especially in the early stages. If you will see, the heart has a heartbeat, but kidney has no kidney beat. So you will never come to know that the function of the kidney is compromised. So if you do the basic tests of the kidney on a regular basis, you will come to know that yes, my kidney is having a problem, and this can be found at the earlier stages, and it may take years for the kidney disease to be evident on the body outside. So here is the kidney function test profile of one of my patients. We have the three most important blood tests done for a kidney patient: BUN, blood urea nitrogen, creatinine, and eGFR. There are other also tests like urine routine, UACR, sonography, etc. But these three tests are the main functioning parameters of the kidney. Serum creatinine, what is it? Serum creatinine is a waste product produced by the metabolism of the muscles by routine working of the muscles. It is cleared out by the kidneys through the urine. How it works? Whenever your kidneys are functioning efficiently, the creatinine is cleared out of. When the kidney function is falling, then the creatinine is not cleaned out and it builds up in the blood. Interpretation tip. It is useful to correlate the creatinine with the eGFR to get a clearer picture. eGFR, estimated glomerular filtration rate. What it is? It is a measure of how much the blood is able to be filtered by the kidney per minute. It is based on a calculation formula which takes into consideration the serum creatinine of the blood, the body mass of the person in weight in kilograms, and the gender of the person, and sometimes also the race, depending on the formula which is used. Importance of GFR. GFR is used for staging of CKD, that is chronic kidney disease, which is the permanent problem of the kidneys. So the CKD stage 1 is when the GFR is more than 90. In this, there may be a structural damage to the kidney like stones, or there may be a non-functioning single kidney on the other side, while one kidney is taking over the function. Sometimes the GFR may be high in over-functioning kidneys due to very high diabetes. The sugar is causing hyperfiltration into the glomeruli. Stage 2 is the GFR from around 60 to 90, which is a mildly damaged kidney, and in this the person needs to have supportive care. Stage 3 is when the GFR is from 30 to 60, in which there is a partition from 3A and 3B of 15 GFR. In this, there is a moderately damaged kidney, and the kidney patient needs to be referred to a nephrologist. GFR from 15 to 30 is severely damaged kidneys, and the person needs to prepare for dialysis by doing a AV fistula on the hand preferably. GFR less than 15 is usually end-stage kidney disease, and this is the stage 5 of CKD, and in this the patient may require to go on to renal replacement therapy like dialysis and kidney transplantation. So in this report of the patient, we are having the creatinine of 1.32 with a normal range up to 1.30, which means it is borderline high. This leads to a calculation of eGFR which is lower because the creatinine is higher, and the eGFR of the person has been calculated to be around 70 with a normal range above 90. So it is a very mildly weak kidney, and we need to find out various causes and reasons for it by a proper history taking and other supportive investigations including urine routine and sonography. If your GFR is below 60 for more than 3 months, it is clinically chronic kidney disease CKD, which is possibly a permanently damaged kidney or a permanently weak kidney. Your GFR is like a goal post of 90. The closer you are to 90, the healthier and stronger are your kidneys. BUN, blood urea nitrogen. What it is? The urea is produced by the digestion and metabolism of the food. It goes into the liver and there it forms the BUN and finally it is excreted out by the kidney. So what is the relation of the kidney to the urea? The kidneys remove the urea from the blood, and if they are functioning well, the urea is maintained at a good level. If the kidney function falls down and the BUN level in the body rises. The normal level of BUN in the blood is around 17 to 20 mg per deciliter. Interpretation tip. Always interpret your BUN along with your creatinine report. The BUN creatinine ratio helps us to distinguish between kidney problem versus dehydration in some of the cases. BUN is like your nitrogenous waste product. If your BUN is high, either your kidneys are lagging behind or you are too dry inside and dehydrated. In this patient, we have the BUN to be around 18, which is actually within the normal range despite having a slightly high creatinine. The BUN is actually within the normal limit. That may be because the person has actually taken a lot of water to reduce the dehydration, which may have caused the slightly high creatinine, is a possibility. Or the liver may be slightly malfunctioning, that is why the BUN is on the lower side, but the kidney is also malfunctioning, that is why the creatinine is on the higher side. So the normal BUN may actually be a diseased person report rather than being a normal report. So with a slightly high creatinine, we go to the other parameters which are available to us, including the uric acid, calcium, serum electrolytes and the phosphorus. In this particular patient, all other parameters were normal except the uric acid, which was very high, so he is possibly a gout patient. So our plan would be to treat the gout uric acid with febuzoxstat, and once the uric acid comes down, then the effect of uric acid on the kidney will also reduce and the creatinine will come down to a good extent. We have to see the trend of creatinine maybe once every 15 days or once a month to confirm that the creatinine comes to the expected limit of 75% of the highest range of the lab. When to get tested, when to meet a doctor for kidney problems. Of course, if you are a diabetic, you are a hypertensive, you are a kidney stone patient, or you have a family history of kidney disease, do visit your doctor as early as possible and get a comprehensive checkup of yourself. If you are having painkiller abuse or if you are having repeated urinary tract infections, that also indicates that you need to meet a nephrologist doctor to find out the various causes and effects on the kidneys. If it is possible, from the age of 40 years onwards, do your annual health checkup once a year and do get yourself checked by an MD physician or a nephrologist as per the kidney parameters. To sum up, if you have a blood test reports in front of you, the creatinine is the muscle breakdown poison which is cleaned out by the kidneys. It is present in everybody, but then it has to be within limits of the range. Your urea is by the digestion of the food, and it also indicates whether you are having a high BUN because of dehydration. While your eGFR is usually around 90 to 60, and if it is on the lower side, you have to get investigated what is the problem with the functioning of the kidney and meet a nephrologist if required. So if you are finding this video to be knowledgeable, do like, subscribe and share to this channel. And if you have any other questions, do write in the comments box below and I will personally reply to them. And do watch the other videos on the channel regarding kidney health and kidney disease and the proper management of kidney disease itself. Always remember, a healthy kidney, a healthy organs in the body leads to a healthy life. Do remain connected and stay in touch.